My introduction is to the Pancare Surpass project. So all the material is already laid out there. So you heard a lot about the Survivorship Passport from Ricardo yesterday, who invented this about 10 years ago. And this is the European project I'd like to share with you today. Ricardo and me are in the coordination role, greatly helped by Monica Muraka and Annalisa Filbert, who are as well present in this course yesterday and today, and about 100 further members from Pancare and all across Europe. So we are really presenting the work of them here. So we answered as well to a call like Leontine already described. So there are different calls coming up, and as longer we are in Pancare, we admire how the work of Pancare might as well be recognized by the European Commission. So now the calls come up, and we were sometimes thinking, oh, they are meaning us. So it's really a lot of work and more work to be done, and we hope we can invite everybody of you to help in this work and being a part in that. Our Pancare Surpass project has the name Scale Up and Implement the Digital Survivors tool into medical systems to improve person-centered care. I'm having problems seeing my, my presentation. So, person-centered care for childhood cancer survivors. This is a broad title. What we are wanting to do is that we, so our overall aim of the Pancare Follow-Up is Pancare Surpass project is to transform the Survivorship Passport in its form, as you heard of it, mostly completed in a paper-based format and manually by hand. And Ricardo told us for years that this takes quite a while, giving the circumstances up to several hours. And this is not practical for the clinical day-to-day work. So we want to transform that into healthcare situation where we easily can link to the medical database or a registry, an electronic health information system, and pull the data out there and putting them in the Survivorship Passport. So this is my lay language. There are IT tools which perfectly can do that. We call them HL7 Fire format, and the HL7 Fire group is helping us a lot with that. So HL7 Fire is something like an adapter. So it pulls out data from an existing database, which is out there in Europe in different formats, and is putting the data in a transformation in the Survivorship Passport as we need them. So this is open source and can be used all across Europe. We of course have to evaluate how this can be done in different countries. So what we want to do is to look at how to more widely can implement the Survivorship Passport to improve survivorship care for survivors of childhood and adolescent cancer in Europe. We would like to assess information by conducting stakeholder interviews, literature surveys to develop a practical implementation strategy. And as I already said, we would like to implement the digital survivorship passport in about 6 countries. More are already interested. And of course, this is, as open as it can be. So if the one and the other of you might be interested to try and implement it in your country, please feel free to contact us. We will collect many information during that period of implementation. That's why we hope to develop a predictive model where all this information will be fed into to help healthcare decision makers in other countries to assess the suitability and costs of the digital surpass, because this of course is a lot of work and will cost the health care system something, and of course we have to assess the effect. We would widely disseminate and communicate our research, like we did this in all the Pancare projects so far, and Pancare, CCI, and Save Europe are a great help in these endeavors. Here, like Leontine displayed as well for her project, these are the 17 partners coming from 8 countries. We have late effects clinicians and registries represented from 6 countries: Spain, Lithuania, Belgium, Italy, Austria, and Germany. We have the IT specialists, namely especially Synica, who's providing the Survivorship Passport, and HL7 Fire Europe, the IT tool for transformation and translation, leading into different, pulling it out from different medical systems into the Survivorship Passport. And of course, we have great help as well from Pintail, namely Kylie O'Brien, who's really doing a good job in managing us all, Princess Maxima and Gesundheit Österreich, and the stakeholder representatives I already named. The Pancare Surplus project is very roughly organized that we, as I already described, pull out the data sources from hospital medical records and cancer registries, putting it by HL7 Fire resources into the treatment summary. So the treatment summary is one of the central elements of the Survivorship Passport, by algorithms and the use of the recommendation, which were mentioned yesterday and just before this presentation, turning them into the Survivorship Care Plan. And this in total is the Survivorship Passport in a paper-based format or as well electronical, like I'm describing it here at the moment. The Survivorship Care Plan is foreseen to be sent back to the data resource where it's coming from, so the hospital medical record, for example. And by that, we hope to provide it as well to more fancy tools, for example, the electronic patient folder we have in many European countries, and as well to the healthcare providers if the patient agrees to that. So in Germany, for example, it's organized that the electronic health care folder is in the ownership of the patient itself. It's quite new and a new development, and they can provide that to, for example, dental examination. So to the dentist, they can specifically choose which record they would like to get to which healthcare practitioner. So this is shown by those errors that the survivor has had on the electronic health record, and can as well give information back to the original resource. Just in short, to show you the work package leader. So we have a management team I already mentioned, and we have pre-implementation work. So this is the first work packages. The work package 1, pre-implementation study led by Leontine, implementation strategy development led by Ruth Ladenstein, the surpass technological challenges I mentioned in the 6 countries led by Katrin Kunaki. Alexander Degelsecker will conduct and analyze the development of prediction model. I skip work package 4, which is the conduct and analysis of a multi-country implementation study in those 6 countries, which we will conduct in as well assessing the empowerment of the patients and how they like the digital transformation into the Survivorship Passport. We have the communication and dissemination tool, and of course project management, and what is last but not least very important, the ethical requirements have to be met as well, especially in this electronical way of completing the passport. Helena van der Paal is leading the communication and dissemination work package, and here you see many other partners which as well stand for several teams. So up and all, we are about 100 members which work hard for transferring the survivorship passport. You can see here from version 1.2, which was mentioned quite a time yesterday, into the version 2.0. So the new element here is the electronic transformation by HL7 Fire. You have seen as a graph like that in similar format. So you see we are exchanging thoughts under the projects and transfer information. As Leontine and Helene already mentioned, the survivorship care plan will be first given to the patient at the end of treatment. So one of our largest goals in this project is that we will have as well recommendations below 5 years of childhood cancer survivorship, as all the recommendations and guidelines start at 5 years survival at the moment. And you can see this lifelong way of follow-up care and late effects care. So this means as well, of course, that the survivorship passport itself has to be updated and updatable several times during the lifespan. The Pancare Surpass work packages, I mentioned them already. I would just, in short, give you a little introduction to the work package 1 led by Leontine. They will assess barriers and facilitators by asking questionnaires, and we will have as well a fancy form of meeting. It's called open space meeting to assess the contextual factors. For example, the LC criteria, which is ethical, legal, social, and economical factors, which can facilitate or hinder the implementation in each of the countries. And we will assess the internal views of healthcare practitioners, IT partners, managers, and of course, very importantly, the survivors themselves. So you can see here, an online survey was already conducted. We invited relevant stakeholders. The information were led back to Princess Maxima, and they assessed the barriers and facilitators. And just a very short insight in one of the main findings. So a lot of the clinical sites asked, so more than 50% said from Leuven in Belgium, Lübeck in Germany, and Bulks in Lithuania, that they are not willing, or they just can't spend more than 30 minutes preparing a survivorship passport. So there's a time restriction, which we could overcome by reducing the preparation time. So the automated or semi-automatic transfer of the data seems to be really very important for the future. We, of course, assess that financial resources are highly needed for the implementation of the survivorship passport, as well if you think not to a local installation at one clinic site, but a national installation. And data access is a topic in general and as well under the survivors. So critical, we have to evaluate possibilities for letting survivors access their own data now and in the future. Work package 2 will assess the LC requirements as well the legal ones where data protection and cybersecurity is a high aim we want to reach, and they will define use cases and define information models for an implementation strategy in all the countries, because you can imagine that the healthcare system in all the countries differ a lot. So just to show you, this is the literature review. So we first started, Ruth Lahnstedt and Vanessa Lisa started at an EU level and try to figure out what is important as well for their country, trying to transfer those findings to all the other countries. Sorry. The technical The technical implementation work packages is work package 3. And we will try to implement a technical architecture by HL7 fire resources, as already said, to transfer the current version of the Survivorship Passport to version 2.0 by means of semi-automatic transformation and interoperability. And as I already said, there are several healthcare systems. I do not want to read you this, let you read that in detail, but I think those graphs show that we cannot display a single solution, how data are extracted from data resources and transferred to the Survivorship Passport. We have to look into the healthcare systems present in the clinic or the national systems. But this is simplified by using the HL7 file specifications. They are online, they are open source, you can have a look at them. So they are using a common scalable high-level architecture, which is already drafted, and now we adapt to that. So it's several cycles where we adapt the, so in lay terms, the current variables and characteristics by the means of fire into the Survivorship Passport variables and characteristics. If this is once done, you can always send it by using fire resources. So this is just a little overview how complex it is to get the data from the 6 clinical sites. We had as well GDPR discussions where we decided that in 3 countries we will have local installations of the Survivorship Passport, and in the 3 other sites we will have an access to the Sinica Pancare Surpass platform, which is situated in Italy. If you yourself are interested in learning more about the passport, or might want to evaluate or think about the implementation of the Survivorship Passport in your country or your hospital, please be invited to contact Ricardo Haupt. Which infrastructure you need is related to what you want to achieve. So if you think of a manual entry of the data, you just need a computer with access to the internet. If you want to do it in a semi-automatic way, you should invest some IT resources and maybe somebody who is keen in using HL7 Fire, which is really the new development in Europe and across the world, would be favorable in this way. We are thinking of further solutions so that the Survivorship Passport might be accessible by survivors via an app one day, or on the electronic smart card, which is under discussion and as well asked by the European Commission. To give you an exemplary experience, just in short, about Germany, we have a funded project as well from the German Childhood Cancer Foundation. So first we had to, in Germany, translate, given the actual publication from Rick Becker, we had to translate the recommendations and the guidelines, which was displayed by Ricardo yesterday, into German, which was quite a task, and I'm very happy that our team here in Germany did it in a very good fashion. So it's quite some work, but we of course have a very good example from other languages already displayed. So it was handleable. And this is an example about the IT infrastructure we will build up at University Medical Center. So we decided for the local installation of the Survivorship Passport. And I just want to mention that Sinica is really of great help and very, very open to transport the Survivorship Passport, which will come in those containers you see here displayed in blue, and they will be linked to the infrastructure, which you can see in green managed on virtual machines at our University Medical Center. So in conclusion, the Pancare Passport project represents a further step forward to the implementation of the Survivorship Passport you've seen yesterday. And the Pancare Passport will develop interoperability tools by HL7 for the two-way data flow from the electronic medical record to the Survivorship Passport and back to the electronic health platform or to the electronic medical record. We will test the SIOP implementation in 6 countries, and we hope that by the predictive model, we will give further advice for future implementation in other countries as well. So you have had some insight into the Survivorship Passport itself, how it looks like. I just want to show you 3 more slides, what you can do there. So you first type in the demographic data, which are dummy data here for sure. Then you can see a general overview over all folders you can complete with data. So we have the diagnosis, frontline treatment, chemotherapy, stem cell transplantation, radiotherapy, major surgeries, and other relevant clinical information events. And this will be updated by a follow-up form, which is under development. If we open, for example, the folder where you can handle all the chemotherapy data or the general overview over the therapies received, you can of course here type in the chemotherapy received. Ricardo showed that as well a little yesterday. So the total cumulative dose is given here, and of course this is more detailed than I show it here. And this will lead to the Survivorship Passport as you have seen it already yesterday. Here you can see the demographical data, so the personal data, and the overview over the treatment summary, and then the recommendations for a follow-up, and as well a little chapter what would be planned for the next visit. So I thank a lot for your interest and attention, and I'm very open for questions.